Thank you, everybody, for your patience with that. We're working to get the camera issue resolved, but in the meantime, we're gonna go ahead and get started with our forum. Thank you again to everybody for being here. Thank you to UW-T Office of Events and Conferences for letting us use this space, and to our amazing IT heroes who are currently trying to figure out what's going on. There will be a Q&A section at the end of the forum. Folks in the room, you heard this already. You've got papers. I'll come and collect those papers as questions towards the end. If you are in the Teams webinar, you can put your questions in the Q&A at any time. I'll see those and get them to our moderator. This feels like a hard transition now, given the silliness we just went through, but before we get started, I want to take a minute to change the tone a little bit and tell you about my friend Stephen Bird. Stephen volunteered with Downtown on the Go for 8 years. He was a huge history buff, and he was a tremendous advocate for mobility of seniors and people with disabilities. And he was the kindest person you would ever meet in your life. And today would have been his 64th birthday. And instead, this afternoon, we're going to be going to his celebration of life. In December, Stephen was murdered in a road rage incident. He was nearly hit by a driver in a crosswalk. Video is back. He was nearly hit by a driver in a crosswalk in Burien, and when he was frustrated about that, the passenger in the car got out and assaulted him, and he did not make it through that incident. And I want to tell you about Stephen because his story is tied to our conversation today, if a little more intense than the rest of what we might talk about. He was legally blind. He was a senior. He had been recently displaced from his longtime apartment in Tacoma due to rising costs on a fixed income, and he was staying with friends until he could get into an affordable unit. What happened to Stephen was a random act of violence, but that type of violence is structurally baked into our transportation and housing systems. Seniors, low-income individuals, and people with disabilities experience that violence at much higher rates. Lack of options and stability push people into unsafe situations out of necessity. And so I want you to remember that you know people who are directly impacted by the topics that we'll be having in this conversation today. And I want to wish Stephen a happy birthday. So on that note, I'm going to pass it over to Tanisha, and we're going to get going. Thanks, everyone.
Thank you, Laura. Thank you for sharing that. I think the interesting thing about what we're going to talk about today is I think it's easy to say, well, this is about seniors, but the thing about it is we're all aging, and whether you are a single person who is contemplating creating a family, or someone who had a family who now all your kids are gone away and you're trying to think about what's the next step for you, or you are a senior living alone trying to figure out how to manage the rising cost of housing, or if you made all the right decisions about your finances and you have a plan of where you're going to go to age, but the cost of that and the availability of those options are harder and harder to get to. So we're all aging, and we're all trying to navigate how we are going to age in place. And there's a lot of places where, as you get older, as you have kids, you have to make choices about where you want to live. And so there's people who love to live in the city, but then have kids and they don't have good walkability. And so then they have to move out to the suburbs. And then you move out to the suburbs, then you get older and you don't have ability to drive and you want to be closer to your services, but you can't get back into the city. It's this flex that happens. And so today we have some great guests with you, a few that are old friends and a few that are brand new friends, but happy just the same to meet everyone. And there's been a lot that's happened to get us here today. The tech issues were the smallest of them. We were supposed to have another guest on our panel, and he was unable to be here with us today for some, personal reasons. And so hopefully he is feeling better and getting, his situation together. But want to give a special shout out to Molly for being a pinch hitter last minute and coming in. And so with that, I'm going to let the panel introduce themselves, and then we will jump into the conversation. And so I'm going to pass to Bucoda.
Thank you, Tanisha. My name is Bucoda Warren. Currently, I serve as the Chief Policy Analyst to the Mayor's Office for the City of Tacoma. Every day, I get to work with a bunch of really great policy analysts and administrative staff that help to support the mayor and the council in their policy goals. So for the city, I'm very close to what we're discussing at those levels with the council on what they're interested in. My engagement with age-friendly work in particular, prior to serving in the Mayor's Office, I actually worked for Tanisha when she was with the City of Tacoma in our Office of Strategy and was the coordinator in charge of the age-friendly action plan when we put that together initially a few years ago with then Councilmember Lillian Hunter. So since then, I've had my hands in and out of that conversation with aging in place in the City of Tacoma.
Hi, my name is Molly Barnett, and I am the Recreation Supervisor with Parks Tacoma, and one of the areas I oversee is senior programming. I have overseen this program for about 2.5 years at this point, and we just expanded our services to be able to help support the closure of a few of our senior centers within the city, and we've really enjoyed expanding those services and getting to know our seniors.
And hi, I'm Nalani Linder, and I'm the Executive Director of TACID, which is the Tacoma Area Coalition of Individuals with Disabilities. We serve folks with disabilities of all kinds. We say visible and invisible, so physical and developmental and cognitive and sensory, as well as behavioral health challenges. I serve about 1,000 people a year, and about 1/5 of them are 60 and over. So I'll get a little more into them and their lives later.
Great. So a few years ago, we had Dr. Medeiros on a panel similar to this, and he talked about the ability for people to age in place, and that what happens when, as people get older, they have to make really hard decisions about where they want to live. Those decisions sometimes impact how well they can get to their doctor, how well they can get to their social network, and that people tend to age faster when they are isolated from their communities. They tend to have a lesser quality of life when they can't get to just, walk over to see their grandkids, or they have to get other people to drive them around. And so from your perspective and maybe some of the work that you've done, can you share with us some of the challenges that are facing the seniors that you work with? And Nalani, we'll go ahead and start with you.
So aging and disability is often lumped together because there are some constraints around mobility, hearing, vision, others that are common for lots of folks that worsen when you age, and some things are things that people are living with all the time. One of the things that is a big deal for folks with disabilities, particularly with mobility issues, is of course just the general accessibility of the place where they are. Stairs, doorways, ramps not being there. I was talking to one of our participants who said that she lives in an apartment complex where she's in one of the accessible units. They lowered the kitchen counters, but they didn't lower the cabinets. So they told her she could just use a step stool. Well, she's in a walker all the time now, and when she was young, she's been there like 20 years, and when she was younger, she braved the step stool, but it is not appropriate for her to do that anymore, so she just doesn't use the cabinets. So basic accessibility is one of those things, and for a lot of folks, making the upgrades to help with accommodations for the accessibility is just really, really expensive. The one more, and I know we have less time, so should I can keep going. The healthcare needs, of course, get more when you age, and so reliable in-home healthcare is expensive. And getting to the place, and Tanisha already mentioned this a little bit, we've got a lot of folks who, for other reasons, have not been able to make a lot of money, so they live where it's affordable, and often that isn't right close to where the healthcare services, especially the specialists, are concentrated. and then we get attached to that is the transportation issue, right? So how long it takes to get someplace if and when you qualify for the shuttle. The last thing that folks brought up when I was talking to them about these challenges was social isolation. You know, that's something for a lot of folks. It's one of the reasons our nonprofit exists, to be a bit of a community hub where people can gather, but it's hard to get. Many people have trouble getting to us, and it's a mental health thing. If you are isolated, you need to stay inside, and it's a little bit of a vicious circle, because if you're not feeling like going out, then you can isolate even more. This becomes even more of a thing. And one quick story, because I have the reverse of this with one of our participants. Maria is elderly. She is an amputee, and I feel like she is constantly waiting for the Pierce County shuttle wherever she goes, because she's always going everywhere, because she knows that social connection is important. She also has a really strong voice for if she can't make it up into, if she has accessibility issues, she goes and knocks on the door of the manager or whoever's there just to explain that this is not okay for folks with disabilities. And I'm just thinking that not everybody has that kind of energy and persistence. So, social isolation, getting to your healthcare needs, and basic accessibility were the big ones.
Molly?
So looking at this from the recreation side of things, we have seen the social isolation has been a big concern. When we were opening up what we call our senior hubs, our seniors were very concerned about making sure that they still had their community and their family, making sure that they still have their meal time together, making sure that they're able to check in on their friends and that they have their activities. We have faced that transportation is also an issue. They were able to navigate some of their previous locations knowing that these were strictly dedicated to our senior population, and moving to a recreation program where we are at a community center. It can be daunting with the large change. We have worked to be able to get transportation happening, but this has been a process of we're building our program with our seniors in mind and alongside our seniors, which makes it for a little bit of a slower process because we want to be able to hear what their needs and their wants are, which causes some frustrations of wanting it to be perfect right now, but we're working through and hearing those voices and making sure that we're creating those opportunities, whether it be a coffee social or a lunch together or even just a walking club. But making sure that we're providing those social opportunities has been absolutely huge, especially seeing the turnout and how much they care for each other. It is truly a family that has come together.
And I'll just add a couple things from the city's perspective. The city as a whole primarily is a funder of our partners and services in the community. That's usually how we engage with a lot of senior services. But two areas where I think the city has a lot more focus in lately, especially, is we've already mentioned the affordability of housing and the housing options across the city. Just finding ways to increase the supply and control rents and control other costs that have to go with housing and transportation is something where the city is very focused on, is a huge priority for the city to address the affordable housing and to create additional housing options for when our seniors are looking to downsize or move back into the urban core when their families are moving off on their own. Having those options available across the city and the different neighborhoods is something that we're very focused on. Additionally, we've done a lot of work in trying to support the digital divide and some digital education. We still have a lot of very personable resources if people come into the building or call the city, that they can get a person on the phone to walk them through it should they not be able to navigate the websites. But we're seeing a lot of just access to Wi-Fi or the ability to navigate a lot of the websites becomes a really big challenge sometimes. Right now, the city's in the middle of a huge website redesign, and one of the pieces of that is the accessibility and understanding and a lot of those tools that make a website more manageable for folks who may have visual impairments, cultural understandings, language understandings, and just making that a much easier tool to navigate and access. And then we're also doing a lot of work with partners like Sound Transit and providing Wi-Fi in your stations and helping to make sure that Wi-Fi is set up in any city-owned facilities so that we have those additional options for folks to find places to connect and get access to those digital resources.
So Kevin had sent us some data earlier this week when we were talking about like kind of what's the scale of the issue, and some of the interesting facts he had in there is that between 2025 and 2030, the number of individuals over the age of 80 is scheduled to increase by 4 million. And they're already, right now, if they're for just building just straight senior, like just, housing for seniors specifically, they would have to double the number of units they're building each year for the next several years to be able to keep up or maintain the level of housing, and that's just for senior facilities. And most seniors don't live in senior facilities. Most seniors just live in the community or live in the house that they bought, 20 years ago with their families. And so when you think about that, the tightness of that and the inability for us to keep up just with affordable housing in general, and then the service, housing that has the services for independent living, assisted living, and then memory care, which are all high cost kind of things. And so it's not a small, incremental problem. It's actually a big problem that we are probably way behind in addressing. So what are, I think when we think about what the broader impacts of that are on the community, it puts a lot of stress on families. As a firm Gen Xer, like my kids are not quite launched, right? My kids are in their early 20s and they are all like just graduating from college, just getting the things at the same time as my mom's turning 74. And so I've had about 15 minutes of not having people in my home and looking at me and my sister talking about what's going to happen with my mom. Now, I'm probably not the person who's going to take care of my mom for lots of reasons. I'm probably not the person best equipped to do that. We have a long history. And so my sister's going to get and she's the little sister, so I get some say so, and she lives closer, so she's winning that lottery. But it still means that I'm going to have to figure out financially how I help my sister take care of my mom. Like the push of like, it's her birthday next week, and or am I driving to Portland to see her, and the day trips to Portland, just to make sure she's not socially isolated. So that's like my pressure. Then we've got Bucoda, who's, younger and starting in his career and has to think about how much money do you actually have to save to take care of yourself, right? So like there's all of these impacts, and I want to invite the panel to talk about like, what are some of those other impacts to this issue that you all see either personally or through your work that I just feel like we're not talking about it. As a community, we're not talking about it. We're not problem solving. We're not having honest conversations about the issue. It's just like, it's just happening around us. We're not acknowledging that people are living longer. People are living with disabilities and with illnesses longer than they have previously. So there's just all these compounding problems. Molly, I'm going to start with you.
I think I would say just accepting the change. That has been a big impact of accepting that people are living longer with disabilities and with illnesses, that programs are changing, that accessibility is changing. I think when looking at that, that is something that we all, while change is hard to accept, it is something we have to acknowledge. And to be able to acknowledge it and take it head on as best we can, we'll be able to provide and change things in a way that will be able to support our community in that sense.
Yeah, I think that's interesting because as you were saying, I was thinking about also what age looks like is different now, right? So when we were talking to Kevin, we were like, well, what is the age? And maybe it was Bucoda. Somebody said 50, and I said, I reject that. I am not a senior. But I think about like even my mom at 70 is still going on trips and doing all these things. Like, and so I know we talked about it when we were doing the age-friendly ordinance that like 50 or 65-year-olds didn't want to like sit and play pinochle. No offense to anybody who likes pinochle, but they wanted to like go on trips. They wanted to do different kinds of things. So even in terms of like, I think my best visual of this is like all the ladies on Golden Girls were supposed to be in their mid-50s. And I'm like, that's not me and my friends. Like, we're flying to Vegas in a week for a jazz festival. I don't know what this group is, right? So like, so I think that's also a change. And I don't know, I know Bucoda, you and Lillian Hunter talked about that a lot. And Nalani, maybe you want to jump in here too.
One of the things that I've learned in my time at TACID is how different, well, the parallel here is the difference in different disabilities. It just impacts your life in so many different ways from the person next to you, because circumstances are different in terms of what level of energy you have, what capacities you've got. And I think that is true for aging as well, right? So one person's 50 is another person's 70, and vice versa, right? And I was talking to a woman the other day who who said her social isolation was a really big deal for her because all of her friends are dying. And she's, outlived 3 husbands. And so here she is, she said, I have to figure out my, and her 2 daughters are at the peak of their careers, and grandkids are busy. So I think it really just reinforces what you're saying. The other thing about this particular lady, though, is that she used to be very active in her community. And she said, you know what? She says, now I just feel invisible. Says, I am in the grocery store. I go and do things, forums like this. And she said, I am looked over. And she really believes this is an age-related thing. And I believe that certainly representing folks with disabilities, that can be true as well.
Yeah, I'll speak to kind of 2 parts. I think just following up on what Nalani was saying, and the way that I've experienced and seen it, I think the attention or the deference to seniors has certainly changed, seen in the workplace in particular. I think a lot of that has to do with a lot of the generational kind of crunching up in the workplace. A lot of the folks that are starting to retire or who've only started to retire, and there's a whole generation behind them who never got into senior leadership and are now also retiring. So we have a lot of younger generations that are pushing people out of the workforce a lot faster. I'm seeing that change, I would say, even in my short tenure in working in government, the deference and the way that people talk about their seniors in the workplace or their mentors very differently. And I think that gets very much back to there's they're not quite invisible yet, but they're given a lot less deference and authority in these conversations, I think, is what we're seeing. Thinking a little bit institutionally, just to share I think how the city's looking at it with people aging longer and seeing these changes in some of these patterns, we're seeing a lot of impact on just the displacement of seniors and not having those housing options available for them. We're seeing a lot more strain on the homelessness and healthcare system that's increasing costs. And for the city, that becomes a larger and larger problem we have to address every couple of years now with our budget, because we are becoming more and more strained for resources and how we support the community. So every time that we come to a budget decision and discussion, we are now having to contend with very shifting demographics that are changing the way that we have to fund these programs.
I'm about to give you the mic back. The city adopted the age-friendly plan in 2021. I know, so that year before Councilmember Hunter introduced that plan, there was a lot of forum. She sat on a forum about building. We were talking about density, and she talked about the lack of parking and the idea that it would take away her autonomy, like taking away her car would take away her freedom to kind of move around. And we were talking about but if you make parking hard and she has to walk too far, then she's not going to certain places, right? Like there's that like friction of, I want to be able to drive everywhere, but I need to be able to drive close enough so that I can walk. And then when we started talking about at the city zoning and restricting parking and having these like walkable communities, she was like, walkable for who? And so there was this tension between like young people were like, I want transit oriented development, I want light rail, I want to be able to walk everywhere. And then from her perspective as a person who was a little bit older, saying, that doesn't work for me because I want to be able to go to the store and just get out and walk in. So that started her down the road of like, how were we going to develop in a way that didn't leave seniors out? And so picking up from there, like what has worked and maybe what are some of the opportunities that we just need to build on?
Absolutely. Just to give a kind of quick introduction to the plan when we adopted it, this was really the city's, I think, first engagement with that conversation and that conflict between generations. And what that means for zoning and transportation is kind of the biggest visible thing. But I think that was the first time we've had that conversation and that policy discussion when this plan was formed. When we developed it, we were working with the strategic plans at the time, Tacoma 2025, other strategic plans for the departments, making sure it really aligned and was an early tool to help identify some of the gaps and needs that we could be exploring and continuing to develop, and making sure that we would incorporate those discussions into future strategic plans. Like later this year, we're working on the next 10-year strategic plan for 25 to 35. A lot of these early discussions from the first action plan and upcoming conversations will help to shape that a little bit and get back into that conversation of some of those conflicts and generations and how the needs of the city need to shape to both ends of that spectrum, really. I think what's really important to kind of say about what's upcoming, what was successful, there was a lot of work that was done during the few years after it was passed. As you know, we went through the pandemic, and it took a few years just for the city to kind of catch itself under its feet and get to the response to that pandemic. And it did delay a lot of the projects that the action plan had identified initially, but there was a lot of really good work that happened over the last few years that have either been inspired by the plan or were aligned with the plan and other plans that helped to make sure the city was still on track to serving age-friendly communities and making sure that there was an ability to age in place. The city has numerous grant and loan programs for home repair and rehabilitation. We talked about not having ramps or handrails in homes, especially some of the older stock, to be able to allow that for those with disabilities or those aging in place that need those infrastructure in their home. We have, especially during the pandemic, there was a huge spike in what we had available for utility assistance and other assistances that helped keep people in their homes. And a lot of this was targeted at senior communities. Over the last few years, the city's been really focused on language access. And I mentioned the website, but there's a lot of other language access tools that we've been developing over the years to make sure that we're talking with especially senior communities from other demographics, from other cultures, that we're having ways that we can speak to these communities and in a really culturally responsive way and be able to provide information in a way that makes sense to them. A few things that help, we've been looking at accessible taxis, to not get too into details with that, but looking at ways that seniors and those with disabilities are accessing things like Ubers, Lyfts, other transportations for that first and last mile. How can we create better connections and availability for those who do not have their own cars so that they can be getting to those places and they don't have to walk too far away to get to where they need to be? And I think two of the largest ones that have a lot of the impact is the city's anti-displacement strategy and Home in Tacoma that was recently adopted by the council. These are huge initiatives that are looking at how do we increase the housing stock and the housing options to make sure that we can increase the supply, lower the cost of housing for folks, and create those additional options for those either downsizing, folks moving to the city, and creating opportunities for intergenerational housing, a lot of mother-in-law suites, ADUs, those kinds of buildings to help ensure that there are spaces for our seniors to move into, that families can cohabitate together in different ways, and just creating options in the city. A lot of that is what we're focusing on in anti-displacement in particular, making sure that when we are building all this new infrastructure, we're doing it with a very mindful focus on not displacing the folks that already live here, wanting to make sure that folks that already live in Tacoma have the opportunity to continue to age in place and stay where they want to stay in the city, and there are resources and options for them to be able to do so. I would say some of the things that we're seeing as just very immediate needs that are causing some struggle is food access continues to be a huge challenge. During the pandemic, we saw a huge spike in federal funding and supports for those kinds of food access, Meals on Wheels, that kind of thing. A lot of that money has dried up now. We're back to pre-pandemic funding levels, and the need has not fallen. So we are now funding maybe a quarter or a third of the need of what we used to during the pandemic years for food access in particular.
And food costs more.
And food costs more, and costs are going to keep rising. So there are a lot of challenges there, and housing protections and utility supports continue to be huge costs, especially for senior communities that we're needing to address in different ways. I'll share just kind of what's next, and there is a lot of opportunity on the horizon, I think, for the city, because as I mentioned, the city is really interested in getting back into this conversation, and some of our council members have been engaging in specifically age-friendly conversations or wanting to pick up this plan again. So as we get into the conversation on the strategic plan this year, we're going to see a revitalization of that conversation of what the original action plan put into motion and bringing it back into the conversation and how we incorporate it into the city's next strategic plan. There's also going to be some renewed interest in how do we engage seniors in our volunteer efforts at the city. A lot of our boards and commissions over the past few years have seen a precipitous drop in senior engagement. Next Tuesday, actually, at the council meeting, they'll be considering a resolution that will prioritize senior engagement and recruitment for our boards and commissions because of that drop off of seniors engaging in our volunteer services and helping find ways to make sure that we can bring people into those boards and commissions. And I think the last one I kind of really focus on is the food bank, just getting back to that, because we know it's such a large issue and we have a lot of different challenges this year with a lot of federal funds dropping off, a lot of changes in what's available to us now. That is one I would say that we are watching very closely, particularly in the mayor's office, of just how we can find new funding opportunities for food access to make sure that we can at least meet the need now so that we can kind of stem that tide of initial problems and really focus on getting back to the root causes and addressing food insecurity.
So we did that really fast and we're running out of time and I want to make sure I can get to questions. So my last question for the panelists is going to be like, what is the one or two things that, this group, the people listening online and the people that show up at these meetings, they're doers. We like to do things. We like to know what to advocate for, what letter we're going to write. Like when we leave here, what's the action? So what are like one or two things that people can do, whether it be volunteer or advocating for a particular policy that can help with this situation? Nalani, we're going to start with you.
When I was talking with folks at TACID about some of their big needs, what came up over and over again is, I think there are some programs that can help. I've heard about these programs. I am utterly overwhelmed when I think about trying to access them, filling out the sea of paperwork that's required. I don't know how long I need to wait. And it made me think of, in healthcare, they've got community health workers. And there are some really great social worker types who come alongside you and help in paperwork and other places. But there just needs to be like a community program worker, helper people to help explain patiently, because we've got folks with cognitive issues who just need a little more sit down time to help them understand how to connect to these things, because there are some good things happening in the city and in the region, and folks aren't able to fully grasp and understand how they're eligible for them.
Molly?
I would say helping bring those same resources to our community that is in need. Volunteering with that, you mentioned it right away. It was like, yes, that I think is a huge thing. We have places where we already have a population of seniors that are there, and it's like, I'd love to be able to meet them where they're at so that it is not having to try to make all the phone calls, try to search for it online. We can be there to support through a system with the resources right in front of them.
Bucoda?
Yeah, I think for the city, of course, there are plenty of ways to get in front of the city council and helping set policy and their interests. I think the number one way would be second and fourth Tuesdays. Those are our community forums. That's when people can come speak to the council about anything over which the city has jurisdiction. Those are good nights to come and share your concerns with the council. It helps to spark ideas, what they might research more into in policy and bring it back for adoption. Additionally, as I mentioned, we'll be going into our strategic planning for the next plan for the city later this year. So keeping an eye out for those community meetings and engagement meetings to be able to provide that specific feedback on age-friendly needs, as well as when council members may, on their own or as a body, bring forward specific meetings on age-friendly action planning or other related topics, just keeping an eye out on the city's channels for those kind of opportunities to engage in those topics.
Thank you. I think one very practical thing that I personally am struggling with my own mother, and it definitely was a struggle with my father. Like, we have to get more comfortable talking about the planning. Like, we have to get more comfortable and create spaces where people can talk about what does it look like when you can no longer get into the cabinet. Do you want to live in an assisted living? Do you want to live, like, it's really that weird space of like when you start having to parent to your parent, and and there's like this little weird space. And I think it wouldn't be so weird if we weren't so afraid to talk about it. It's really hard for kids to bring it up to their parents, and it's really hard for parents to say there might be a time where I won't be the one that's caring for you and you'll be caring for me. And so I think we just need to practice that a little bit more and create spaces where we can talk about it, where it doesn't feel crazy. Like, I know that my mom wants to be independent as long as she can, and I want that for her because I feel like she will crumble when at the point where she can't. But we have to talk about what that looks like and how do we know when that point is there, because it's a really hard thing for a kid to tell their mom. Like, I mean, my dad, like, he told a story about driving, and then one day he was driving and realized like the cars were just going really fast, and his reaction time was slower. And he was like, it scared me, and I decided I didn't want to drive anymore. But like, why did we wait till we got there? Like, why were you in the car freaking out when you made that decision? My dad was also very, very independent. One time I called to see how he was doing. He was 82, and he was on the roof cleaning the gutters and answered the phone. And I was like, sir, I need you not to do that anymore. Okay, on to your questions. Okay. Are there any creative intergenerational ideas around housing, community transportation, et cetera, that you're excited about?
Know that those exist. So now are there things that like that in Tacoma? Because I've heard about them in other communities and they're fantastic. I love I came from child, yes, I'm getting nods that happens in Tacoma as well.
What are they?
Oh, okay. You know that happens elsewhere. What would excite me? So I came out of child welfare in my first career, and there were folks who were helping, like grandparents who were helping to do faux kinship care
Yep.
to young people, and it was such a blessing on both sides. So that is really exciting and very practical.
I saw a program in Cleveland where they had renovated a school, and they had an after-school program, but the building was actually a hospital. So one side of the building was senior living, one side was schools, and they actually had medical clinics on one side. So like seniors kind of had their own ecosystem, but the seniors could sign up to teach classes to the kids that were in the after-school program. And so there was like this guy doing a workshop, like actually teaching woodworking. And there was like these kids out making chairs, and like everybody was so happy. And I thought it was like the coolest program. I've seen lots of programs, but that was like one of my favorites ever.
So one of the programs I also oversee is youth engagement. And this is actually something we're trying to pilot for 2025, is we're calling it Seniors to Seniors. So bringing our senior community with our seniors in high school or our high school students. I primarily work with high school students, and how we can help support both of those age groups in where they are at in life right now. So while I do not have quite all the details, this is a goal that is a part of my group. So for over the next couple of years of really expanding that. We already have a few where they cross into each other's programming of volunteering for, we have a senior ball, like senior as in like 60+ ball. And we have our seniors in high school that come and like serve hot chocolate, and they get to go and dance with our seniors. And I think just bringing generations together as well. I think there is definitely a fear of bringing a generation together sometimes, but I think leaning harder into it, that's what makes me excited.
Very cool.
My idea is not a new one because it's basically what yours is, except for the Parks District. It's senior housing over a community center and having that engagement there. Similar design to this, though.
Yeah. There is a really cool program, I think it's on the TPS website still, where some seniors came and made cookies and served them to the kids at Oakland. And the kids at Oakland, if you're not familiar with Oakland, is kind of an alternative school. They're kids that have just not done well in school. Some of them have like went to Raymond Hall and came back. And so they're just like a group that sometimes they don't have the family connections. And they were so happy, and there was like these conversations happening, and it's like some of them, it seemed like it was the first time anyone had made them cookies, but it was just a very simple kind of thing. And I think we just need to be more intentional about those interactions. All right, next question. How do you see the city and parks and maybe TACID supporting AI and other emerging technologies to teach seniors?
We are currently offering tech clinics that happen monthly. They rotate through our community centers. This is part of where our seniors in high school have come into as well, is just helping explore technology. So I can honestly say, I don't know if IA has come up yet, but we have done getting through with emails, making sure we understand our new phones, bringing in cameras and computers, and making sure that they understand how to log into something properly. I mean, we've even gone as far as like we've had like a sweetheart thing where we've had dating and how we can navigate through dating sites like that, because that is definitely a huge thing that has come up as well. So we have just a kind of a generic, here, come to our tech class so that we can struggle through this together. That has been rather successful.
And I'll say for the city, we haven't engaged in that kind of conversation yet that I'm aware of, but the city recently adopted, I believe it was last year or the year before, our own AI policy, just as we get into exploring what AI is for government and how we can utilize it in the community. And I know that we're looking at rolling out new AI tools for the city this year. So there is a lot of early learning in AI just in terms of how do we use it in the workplace and what might it be used for. So I'm certain that these kinds of conversations will be coming soon, but we're still in those early stages of understanding the tool.
I know there's UW-T has classes that seniors can take for free, or I don't know if they're all for free, but there are a group of senior classes, which I think is also a cool thing. Like if you're in a lecture class and someone who's like lived life and done things, and you're pretty young and you're learning about it in theory, it's a cool experience to have someone a little bit older who has a different perspective in your class with you. And I don't know that we talk about that a lot, that those are available for people to take. This one, Bucoda, you're going to get it because I don't think anybody else can speak to MFTE. I don't know if you can answer this question. Somehow the MFTE doesn't require units to be accessible. It allows a 7-step to enter units. If a person became mobility disabled, they would have to move. Is anything being done to fix this?
Not that I know of. I did take this note because it's something that I'm going to bring back to our MFTE team just to ask. But as I'm sorry. The MFTE program is the multifamily tax exemption program. It's a statewide program that allows us to provide 8 and 12-year tax exemptions to those new developments that build multifamily properties. And it's a program that is meant to incentivize supply by building new units. There is a somewhat affordability component of it that folks are able to get that larger 12-year, and I believe the state now has a 20-year exemption if you're providing a certain percentage of your units as affordable housing that has a bit of rent control to it. But I don't believe, to my knowledge, and this is something I'll check in on and provide it back to Lauren and the Downtown on the Go so that they can share it out, is I don't believe accessibility is part of the state code on a requirement for that program, but something I'll look into.
Well, we are right on time, which that's amazing. We have talked really fast. At one point I was listening to Bucoda and I was like, he is talking fast, but I love that. Thank you. I appreciate it. I do think this is one of those things where we all have to be a little bit urgent about the issue. There's lots of stuff happening at the federal level that might affect what people's Social Security payments, whether their Medicare coverage, and all of these things will only exacerbate these problems. We really have to look at the fact that the cost of housing is outpacing what people are getting for Medicare. So even if you made a plan 15 years ago about how you were going to be, like my dad used to always say, your plan is to for your money to outlive you. And he made that plan. But, there's all types of things that we didn't get to talk to today about predatory practices. I live in the house that I grew up in. My father's no longer here with us, but I get a call probably twice a month from somebody trying to buy our house for $350,000. And I'm like, and he'd move where? But if my dad was still alive, with still the compulsion he had to take care of his children and to, not be a burden when he got sick, he may have considered selling the house thinking, well, I bought this house for $65,000 and now it's, that someone's going to give me $350,000 cash. That sounds like a good deal if he didn't understand that there's no other place to move in the city of Tacoma for $350,000. Well, I live in Steilacoom, so there's definitely no place to live in Steilacoom for $350,000. So there's lots of elements to this. And I think if I want to leave you with anything, it is to lean into those conversations and to call your legislature and show up at city council meetings and express what your worries are, because if we don't, it's easy for this to be an invisible problem. So with that, I'm going to pass it back to Laura, and I hope I see you guys for our last one of the season next month.
Yeah. Let's give a round of applause for our panelists. Thank you, everybody. And thank you, everyone, for especially struggling through with us on those tech issues. We appreciate everyone's patience on that. Yeah, I want to invite you to our last Friday Forum of 2025 on March 28th. It will be on transit in the South Sound. I'm excited about that one. A recording of this forum will be available on our social media next week. So if you want to share it with other people, if you want to watch it back, you are very welcome to do that. Yeah, and we're grateful for your time and your attendance today and your engagement with this important conversation. And there was some really good conversation happening in the Teams chat as well. So thank you all, and we'll see you next month. Thanks.
Oops, we're going to stay around up here. If you had a question that you didn't ask, we'll be here for like 5-10 minutes if you want to come up and ask us to. Thanks.